Welcome to BoxedIn Health, where knowledge and wellness converge, sparking transformative journeys to a better you. Today, we uncover the topic of Nipah virus. The Nipah virus, NIV, is a type of virus that can jump from animals to humans, known as a zoonotic virus. It can also spread through contaminated food or direct human-to-human contact. Once a person is infected, the symptoms can vary from no visible signs, asymptomatic, to severe respiratory issues and fatal brain inflammation, encephalitis. The virus can also be devastating for animals like pigs, causing significant financial losses for farmers. While Nipah virus has caused only few outbreaks in Asia, it's a concerning public health issue because it can infect a wide range of animals and lead to severe illness and death in humans. To protect yourself, it's important to minimize exposure to sick animals, particularly bats and pigs, in areas where the virus is known to be present. This involves avoiding food products that might be contaminated by infected animals, such as raw date palm sap or fruit. Additionally, because the virus can spread through bodily fluids, it's essential to exercise caution or stay away from individuals who are infected with Nipah virus. Nipah virus past outbreak. The Nipah virus made its initial appearance in 1999 during an outbreak affecting pig farmers in Malaysia. Subsequently, it emerged in Bangladesh in 2001 and has continued to cause outbreaks almost every year in that region. The disease has sporadically re-emerged in parts of eastern India as well. Evidence of the virus has been found in the natural reservoir, Terapus bat species, and several other bat species in various countries, including Cambodia, Ghana, Indonesia, Madagascar, the Philippines, and Thailand. This suggests that other regions may also be at risk of infection from the Nipah virus. Human infections caused by the Nipah virus can manifest in a range of ways, from no noticeable symptoms, asymptomatic, to mild or severe acute respiratory infections, and potentially fatal encephalitis. The incubation period, which is the time between getting infected and the onset of symptoms, typically spans from 4 to 14 days. However, there have been cases where the incubation period extended up to 45 days. The initial symptoms of a Nipah virus infection may include fever, headache, difficulty breathing, cough, sore throat, diarrhea, vomiting, muscle pain, and severe weakness. In severe cases, the infection can progress to a life-threatening brain infection known as encephalitis. Additional severe symptoms comprise dizziness, drowsiness, confusion, slurred speech, seizures, coma, and respiratory distress. Nipah virus should be considered a significant potential diagnosis in individuals experiencing fever along with symptoms of brain inflammation, encephalitis, or acute respiratory distress syndrome, ARDS, especially in areas currently affected by an outbreak or if there's a relevant travel history to affected regions. However, it's essential to note that various conditions can present with similar symptoms, and it's crucial to view potential diagnoses in the appropriate context. When suspecting a Nipah virus infection, medical professionals should also consider the following potential differential diagnoses: Japanese encephalitis, JE, measles, rabies, dengue encephalitis, cerebral malaria, scrub typhus, leptospirosis, herpes encephalitis, and bacterial meningitis. To determine a Nipah virus infection, a healthcare professional will assess your symptoms and inquire about recent travel to regions where Nipah virus is prevalent. In the initial stages of infection, a real-time polymerase chain reaction, RT-PCR, test can be conducted to confirm the presence of the Nipah virus. This test utilizes various bodily fluids for diagnosis, including nasal or throat swabs, cerebrospinal fluid, CSF, urine samples, and blood samples. In the later stages of the infection or during recovery, healthcare providers may diagnose the infection by testing your blood for specific antibodies using a method called enzyme-linked immunosorbent assay, ELISA. Additionally, the virus can be isolated and confirmed through cell culture. Treatment and management. Unfortunately, There are currently no specific antiviral drugs to directly treat the Nipah virus. Therefore, the focus of treatment involves effectively managing your symptoms. Drinking ample fluids to stay hydrated. Resting and allowing your body to recover. Using common over-the-counter medications like acetaminophen or ibuprofen to alleviate symptoms like fever and pain. Employing medications that help control nausea or vomiting if needed. Using inhalers or nebulizers to ease breathing difficulties, if present. Taking anti-seizure medications in case of a seizure. Scientists and medical experts are actively researching the potential of using monoclonal antibody treatment for Nipah virus, which holds promise for future treatment options. Prevention. Minimizing the risk of Nipah virus infection in people is crucial, especially in the absence of a vaccine. This involves creating awareness about the risk factors and educating individuals about proactive measures they can take to lower their exposure to the virus. Public health education should emphasize the following key points. Reducing bat-to-human transmission risk. Educating about strategies to minimize the transmission of the virus from bats to humans is essential. This includes preventing bats' access to date palm sap and other fresh food products. Protective coverings, such as bamboo sap skirts, can deter bats from sap collection sites. Proper hygiene practices like boiling freshly collected date palm juice and thoroughly washing and peeling fruits are vital. Fruits showing signs of bat bites should be discarded. Reducing animal-to-human transmission risk. Encouraging the use of gloves and protective clothing while handling sick animals or their tissues, especially during slaughtering and culling procedures, is important. It's crucial to minimize contact with infected pigs and protect pig feed and sheds against bats when establishing new pig farms, especially in areas where fruit bats are prevalent. Reducing human-to-human transmission risk. Educating people to avoid close, unprotected physical contact with those infected by the Nipah virus is critical. Regular hand washing after caring for or visiting sick individuals is a simple yet effective practice to reduce the risk of transmission. In healthcare settings where infection control is paramount, healthcare workers must strictly implement standard infection control precautions when caring for suspected or confirmed Nipah virus cases or handling specimens from them. Due to reported human-to-human transmission, additional precautions like contact and droplet precautions should be employed, alongside standard precautions. In certain situations, airborne precautions may be necessary. Proper handling of samples from suspected Nipah virus cases, whether human or animal, should be carried out by trained staff in suitably equipped laboratories to minimize the risk of infection spread. If you enjoyed today's video, don't forget to like, share and subscribe for more informative content like this. Thanks for watching. See you again with another video.